Question 1. In the context of medical imaging and patient safety, Dr. Thompson is conducting a scan on a 45-year-old patient with a history of severe asthma. The patient has been informed about the procedure, but Dr. Thompson is concerned about the potential risks of radiation exposure in light of the patient's medical history. What should Dr. Thompson consider when deciding the appropriate imaging modality? A. Use an MRI instead of ET. MRI does not involve ionizing radiation. B. Proceed with the CT scan as the risk of radiation is minimal in patients with asthma. C. Consider using a low-dose CT scan ensuring the ALARA principle is applied. D. Postpone the procedure and refer the patient to a pulmonologist for further assessment. Answer. Correct answer. A. Use an MRI instead of ET. MRI does not involve ionizing radiation. Explanation. The ALARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure to patients. In this scenario, MRI should be prioritized over ET. MRI does not use ionizing radiation. CT scans, while valuable for diagnostic purposes, should be used with caution, particularly in patients with respiratory conditions like asthma, where radiation-induced lung damage could pose additional risks. The ALARA principle should always guide the decision-making process when selecting imaging modalities, especially in vulnerable populations. Question 2. While examining a patient's recent mammography images, Dr. Lee notices an area of concern in the breast tissue. The patient is of average risk and has no significant family history of breast cancer. However, she is over the age of 40. What is the most appropriate course of action based on current BI-RADS guidelines? A. Perform a follow-up ultrasound to assess the characteristics of the mass. B. Immediately recommend a biopsy of the suspicious area. C. Schedule the patient for an MRI to evaluate the extent of the abnormality. D. Reassure the patient and suggest another mammogram in 1 year. Answer. Correct answer. A. Perform a follow-up ultrasound to assess the characteristics of the mass. Explanation. According to BI-RADS guidelines, when a suspicious mass is identified in a mammogram, additional imaging with ultrasound is often indicated, especially in patients of average risk with no significant family history. This helps to determine the characteristics of the mass and whether it requires further investigation through biopsy. MRI is typically reserved high-risk patients or when there are significant findings that warrant further evaluation. Reassurance without additional imaging would not be appropriate in this case given the suspicious findings. Question 3. Dr. Patel is preparing to perform a liver biopsy on a patient diagnosed with cirrhosis. The patient's recent imaging shows mild to moderate portal hypertension. What is the primary consideration that Dr. Patel must address to ensure patient safety during the procedure? A. Ensure that the patient is not pregnant, as liver biopsy poses risks during pregnancy. B. Assess the patient's coagulation status to prevent bleeding complications. C. Monitor the patient's blood pressure closely to prevent hypotension during the biopsy. D. Confirm that the patient has an allergy to iodine to prevent contrast reaction. Answer. Correct answer. B. Assess the patient's coagulation status to prevent bleeding complications. Explanation. Liver biopsies, particularly in patients with cirrhosis and portal hypertension, carry significant risks, especially related to bleeding. Ensuring the patient has an appropriate coagulation status, including normal platelet count and clotting factors, is critical. Coagulopathy is common in cirrhotic patients, which can increase the risk of bleeding during invasive procedures. While pregnancy and contrast allergies should always be considered, the primary concern in this scenario is bleeding prevention due to the patient's underlying liver disease. Question 4. Considering the growing trend in patient-centered care, Dr. Roberts is discussing the need for informed consent with a patient about an upcoming CT-guided biopsy. What factors should Dr. Roberts prioritize to ensure effective communication with the patient? A. Focus on the technical aspects of the procedure, as the patient is likely most concerned about how the biopsy works. B. Provide information about the risks, benefits, and alternatives to the procedure while addressing the patient's concerns and preferences. C. Reassure the patient that the biopsy is completely safe, minimizing the need for further explanation. D. Only mention the risks of the procedure in passing, as most patients do not need to hear about them in detail. Answer. Correct answer. B. Provide information about the risks, benefits, and alternatives to the procedure while addressing the patient's concerns and preferences. Explanation. Informed consent is a critical aspect of patient-centered care. Dr. Roberts should provide a comprehensive explanation of the risks, benefits, and possible alternatives to the CT-guided biopsy, ensuring the patient fully understands the procedure and has the opportunity to ask questions. This aligns with the ethical requirement for shared decision-making, where patients are given the information necessary to make an informed choice. Minimizing the risks or omitting information would violate ethical guidelines related to patient autonomy. Question 5. When considering radiation protection in diagnostic imaging, which of the following principles should be applied when performing imaging on pediatric patients? A. Always use the same radiation doses you would for adult patients, as children have a similar tolerance for radiation. B. Just the imaging protocol to minimize radiation exposure while ensuring diagnostic quality, adhering to the ALARA principle. C. Avoid using any imaging techniques that involve ionizing radiation, regardless of the clinical indication. D. Increase radiation doses for pediatric patients to ensure faster and clearer imaging results. Answer. Correct answer. B. Just the imaging protocol to minimize radiation exposure while ensuring diagnostic quality, adhering to the ALARA principle. Explanation. The ALARA principle, as low as reasonably achievable, is particularly important when imaging pediatric patients, as they are more sensitive to the harmful effects of radiation. Pediatric imaging protocols should be adjusted to minimize exposure while still ensuring that the diagnostic quality of the images is maintained. This approach helps mitigate the potential long-term risks of radiation exposure, such as an increased likelihood of developing cancer later in life. It is not appropriate to increase radiation doses for pediatric patients, nor should imaging modalities that involve ionizing radiation be avoided unless absolutely necessary. Question 6. Dr. Martinez is reviewing the case of a 60-year-old patient with suspected lung cancer. A key has already been performed, and Dr. Martinez is considering whether to perform a PET scan for staging. What is the most important factor to consider before proceeding with a PET scan? A. The cost of the procedure, as PET scans are expensive and may not be covered by insurance. B. The patient's renal function, as PET scans require the use of radiotracer that may be harmful in cases of renal insufficiency. C. The patient's prior imaging history, as PET scan may overlap with previous CT or MRI results. D. The potential diagnostic benefit of the PET scan in determining the stage and extent of the cancer. Treatment planning. Answer. Correct answer. D. The potential diagnostic benefit of the PET scan in determining the stage and extent of the cancer, guiding treatment planning. Explanation. The primary consideration when ordering additional imaging such as a PET scan is the potential diagnostic benefit it offers. A PET scan can help assess the metabolic activity of tumors and provide critical information on the staging and spread of cancer, which is essential for determining the appropriate treatment plan. While renal function and imaging history are important factors, the decision should be primarily based on whether the PET scan will provide valuable information that guides clinical management and treatment decisions. Question 7. In the case of a 35-year-old female patient with a known family history of breast cancer, Dr. Jackson is planning her first mammography. The patient is worried about radiation exposure. How should Dr. Jackson address the patient's concerns in line with radiation safety and ALARA principles? A. Reassure the patient that mammograms are very low risk and provide minimal exposure. B. Suggest that the patient under MRI instead, so MRI avoids radiation exposure entirely. C. Explain the necessity of the mammogram for early detection of potential breast cancer while minimizing radiation exposure by using the lowest dose possible. D. Advise the patient to delay the mammogram for a few more years until she is 40, as the radi risk increases with age. Answer. Correct answer. C. Explain the necessity of the mammogram for early detection of potential breast cancer while minimizing radiation exposure by using the lowest dose possible. Explanation. Mammography is an important screening tool for breast cancer, especially in women with a family history of the disease. Dr. Jackson should explain the importance of early detection while emphasizing that radiation exposure during a mammogram is minimal and within the safety standards. The ALARA principle should guide the approach, ensuring that the lowest possible dose is used to achieve the necessary diagnostic quality. Offering MRI as an alternative for all patients is not appropriate, as it is not recommended as the first-line screening tool for breast cancer. Question 8. Considering the clinical utility of ET and MRI in assessing vascular pathologies, Dr. Evans is evaluating a patient with suspected aortic dissection. What is the most appropriate imaging modality to confirm the diagnosis? A. MRI, as it provides superior contrast resolution and is the gold standard for vascular imaging. B. CT angiography, ETA, as it is more readily available and provides rapid, detailed imaging of the aorta in suspected aortic dissection cases. C. A plain X-ray, as it is sufficient to visualize an aortic dissection. D. An ultrasound, as it is the least invasive option for assessing the aorta. Answer. Correct answer. B. CT angiography, ETA, as it is more readily available and provides rapid, detailed imaging of the aorta in suspected aortic dissection cases. Explanation. In the case of suspected aortic dissection, CT angiography is the imaging modality of choice due to its rapid availability, high sensitivity, and ability to provide detailed images of the aorta, while MRI is also an excellent tool for vascular imaging. CT angiography is preferred in acute settings where time is critical. Plain X-rays and ultrasound are not sufficient for accurately diagnosing aortic dissection due to their limitations in visualizing the aorta and detecting subtle vascular abnormalities. Question 9. Dr. Shaw is reviewing the CT scan of a patient with a suspected brain tumor. The scan shows a lesion in the frontal lobe, and Dr. Shaw is considering whether contrast administration is necessary for further evaluation. What is the primary factor that should influence the decision to use contrast in brain imaging? A. The patient's age, as contrast is usually not recommended for older patients due to the risk of nephrotoxicity. B. The size and location of the lesion, as larger or more centrally located lesions are more likely to require contrast for better visualization. C. The clinical suspicion of malignancy, as contrast helps distinguish between benign and malignant lesions. D. The presence of prior imaging studies, as contrast is unnecessary. Prior non-contrast imaging is available. Answer. Correct answer. C. The clinical suspicion of malignancy, as contrast helps distinguish between benign and malignant lesions. Explanation. The use of contrast in brain imaging is generally guided by the clinical suspicion of malignancy. Contrast helps to enhance the differentiation between benign and malignant lesions by highlighting areas with abnormal vascularity, which is typical of tumors. The size or location of the lesion may influence the technique, but the primary reason for using contrast in this case would be to evaluate the potential for malignancy and obtain a more detailed view of the lesion's characteristics. Question 10. In the context of quality improvement in radiology, Dr. Thompson is leading a project to reduce patient wait times in the radiology department. What strategy is most likely to improve workflow efficiency without compromising diagnostic accuracy? A. Increase the number of radiologists and imaging technicians on staff, regardless of the financial implications. B. Streamline patient scheduling and ensure that imaging protocols are optimized for efficiency and accuracy. C. Reduce the use of advanced imaging techniques such as MRI and ET in favor of simpler modalities like X-rays. D. Encourage patients to arrive early for appointments to reduce delays. Answer. Correct answer. B. Streamline patient scheduling and ensure that imaging protocols are optimized for efficiency and accuracy. Explanation. Optimizing workflow in radiology requires careful attention to scheduling, imaging protocols, and resource allocation. Streamlining patient scheduling ensures that appointments are managed efficiently, reducing wait times while maintaining the quality of care. Imaging protocols should be tailored to maximize diagnostic accuracy while minimizing unnecessary delays or redundant procedures. Simply increasing staffing or reducing the use of advanced imaging techniques would not necessarily lead to improved efficiency or diagnostic outcomes. Question 11. Given the circumstances of a patient presenting with a suspected cerebral aneurysm, which imaging modality would be the most effective for both diagnosis and planning of surgical intervention? A. MRI of the brain with contrast. B. CT angiography ETA of the brain. C. Cerebral angiography. D. Say. D. Ultrasound of the brain. Answer. Correct answer. C. Cerebral angiography. D. Say. Explanation. In the context of a suspected cerebral aneurysm, cerebral angiography, also known as digital subtraction angiography, DSA, is considered the gold standard for both diagnosis and treatment plan. DSA provides the most detailed imaging of cerebral blood vessels, allowing for precise visualization of the aneurysm's size, shape, and location, which is critical for surgical intervention. MRI and ET angiography are also useful but do not offer the same level of detail and precision as ESA, particularly when planning procedures such as coiling or surgical clipping. Ultrasound is not an appropriate modality for cerebral aneurysm evaluation. Question 12. In terms of radiation safety, how should a radiologic technologist adjust the imaging technique when performing a scan on a pregnant patient during the first trimester? A. Use a low radiation dose but proceed with the scan as normal. B. Always avoid any radiologic procedures on pregnant patients during the first trimester. C. Consider alternative imaging modalities such as MRI to minimize fetal exposure. D. Administer a protective lead shield to the patient's abdomen to prevent radiation exposure. Answer. Correct answer. C. Consider alternative imaging modalities such as MRI to minimize fetal exposure. Explanation. The first trimester is a critical period of fetal development and radiation exposure should be minimized. MRI is an excellent alternative imaging modality as it does not involve ionizing radiation. If AKI is absolutely necessary, careful consideration of the radiation dose and the use of shielding, e.g. a lead apron, may be appropriate, but the primary goal should be to explore non-radiation options. The idea of completely avoiding radiologic procedures is not feasible in all cases, especially when the benefits of the scan out. Risks, however, limiting exposure through alternative methods is a key principle in radiologic safety for pregnant patients. Question 13. When considering the application of ELARA as low as reasonably achievable principles, which of the following is the best strategy to reduce radiation exposure during a chest X-ray in an adult patient? A. Increase the radiation dose to improve image quality. B. Use a higher energy setting to penetrate the chest tissues more effectively. C. Ensure proper collimation and reduce the area of exposure to the region of interest. D. Conduct the procedure without the use of a protective lead apron. Answer. Correct answer. C. Ensure proper collimation and reduce the area of exposure to the region of interest. Explanation. ELARA principles aim to reduce radiation exposure while maintaining image quality. Proper collimation, or narrowing the beam to the region of interest, helps to reduce unnecessary exposure to surrounding tissues. Increasing the radiation dose or using higher energy settings does not align with ELARA principles, as this would increase overall exposure. A lead apron is typically used for protecting sensitive areas, but it is not the primary method for reducing radiation dose in this scenario. The collimation is the most effective way to minimize unnecessary radiation. Question 14. In the case of a 65-year-old male patient presenting with unexplained back pain who is suspected of having a vertebral fracture due to osteoporosis, what would be the most appropriate initial imaging study? A. MRI of the spine. B. X-ray of the lumbar spine. C. CT scan of the spine. D. Bone density scan DEXA. Answer. Correct answer. B. X-ray of the lumbar spine. Explanation. In the case of a suspected vertebral fracture, X-ray is typically the first-line imaging modality. X-rays can effectively detect fractures and assess for osteoporotic changes in the vertebrae, while MRI is sensitive for detecting soft tissue changes and spinal cord compression. It is usually not the first choice unless there is concern for neurological involvement. CT may be useful for further assessment of complex fractures, but it is not typically used for initial evaluation. A bone density scan DEXA is used for osteoporosis risk, but it would not be diagnostic for an acute fracture. Question 15. Under the assumption that a radiologist is interpreting a mammogram, which of the following BI-RADS categories would most likely correspond to a finding that requires immediate biopsy due to suspicion of malignancy? A. BI-RADS 2, benign. B. BI-RADS 3, probably benign. C. BI-RADS 4, suspicious. D. BI-RADS 5, highly suggestive of malignancy. Answer. Correct answer, D. BI-RADS5, highly suggestive of malignancy. Explanation. BI-RADS categories are used to assess the likelihood of malignancy based on mammographic findings. A BI-RADS5 classification indicates a high likelihood of malignancy, typically greater than 95%, and biopsy is strongly recommended for further evaluation. A BI-RADS4 classification indicates suspicious findings where biopsy is also recommended, but likelihood of malignancy is lower than in BI-RADS5. BI-RADS2 is used for benign findings, and BI-RADS3 refers to probably benign findings, typically followed by short-term follow-up rather than biopsy. Question 16. To better understand the clinical significance of contrast-induced nephropathy, CIN, following CT with contrast, what are the most important preventive measures that a radiologic technologist should consider when preparing a patient for a contrast-enhanced study? A. Ensure the patient is well hydrated before the procedure. B. Administer a higher dose of contrast to ensure optimal visualization. C. Limit the duration of the CT scan to reduce nephrotoxic risk. D. Provide the patient with a prophylactic dose of a diuretic prior to the study. Answer. Correct answer, A. Ensure the patient is well hydrated before the procedure. Explanation. Contrast-induced nephropathy, CIN, is a risk factor for patients undergoing contrast-enhanced imaging, particularly those with pre-existing renal conditions. Ensuring adequate hydration before the procedure is the most important preventive measure to reduce the risk of CIN, as it helps to flush the contrast agent from the kidneys and dilute its effects. Administering a dose of contrast or using diuretics is not recommended, as these could exacerbate renal strain. Limiting the duration of the CT scan may be relevant to radiation dose, but it does not directly influence CIN risk. Question 17. According to recent studies on radiation exposure, which of the following imaging modalities has the highest risk of radiation-induced cancer over a patient's lifetime? A. Chest X-ray. B. CT scan of the abdomen and pelvis. C. MRI of the brain. D. Ultrasound of the abdomen. Answer. Correct answer, B. CT scan of the abdomen and pelvis. Explanation. CT scans, particularly those involving the abdomen and pelvis, involve higher doses of radiation compared to other imaging modalities like X-rays or MRIs. Studies have shown that CT scans, due to the larger volume of tissue irradiated, pose a greater risk of radiation-induced cancer, while chest X-rays and MRIs, which do not use ionizing radiation, carry low risks. Ultrasound is also safe from a radiation perspective. Efforts to minimize unnecessary CT scans are critical, especially in younger patients who are more sensitive to radiation. Question 18. A 72-year-old female with a history of breast cancer presents for follow-up imaging. Given the patient's history and current concern for potential metastases, which imaging study would be the most appropriate for staging and evaluation? A. Mammogram. B. Chest X-ray. C. PET scan. D. MRI of the breast. Answer. Correct answer, C. PET scan. Explanation. For staging and evaluation of metastatic breast cancer, a PET scan is the most appropriate study. PET scans are highly sensitive for detecting both primary and metastatic tumors, and the combination with CT allows for precise localization. Mammography is typically used for screening and evaluation of primary breast lesions, but it is not ideal for detecting distant metastases. Though the breast is useful for assessing the primary tumor, particularly in dense breast tissue, but a PET scan provides superior information for metastatic evaluation. Question 19. From a clinical perspective, when managing a patient who has just undergone a biopsy using CT guidance, which of the following is the most critical step in ensuring patient safety during the post-procedural phase? A. Monitor the patient for signs of an allergic reaction to contrast. B. Ensure the patient remains immobile for at least 6 hours after the procedure. C. Verify that there are no complications such as bleeding or pneumothorax. D. Administer pain medication immediately after the procedure to prevent discomfort. Answer. Correct answer, C. Verify that there are no complications such as bleeding or pneumothorax. Explanation. After a biopsy guided by CT, the most critical post-procedural concern is to monitor for complications such as bleeding, pneumothorax, or organ injury, which can occur due to the invasive nature of the procedure, while monitoring for allergic reactions to contrast is important. This typically occurs during or immediately. Contrast administration. Keeping the patient immobile for extended periods is not necessary unless dictated by specific clinical concerns. Pain management is also important, but it is secondary to addressing potential life-threatening complications. Question 20. When examining a radiologic image of the abdomen, what is the most critical diagnostic feature that would indicate the presence of a bowel obstruction on a plain film X-ray? A. Presence of free air under the diaphragm. B. Dilated loops of bowel with air fluid levels. C. Enlargement of the liver. D. Thickened bowel walls. Answer. Correct answer. B. Dilated loops of bowel with air fluid levels. Explanation. The presence of dilated loops of bowel with air fluid levels on a plain film X-ray is a classic sign of bowel obstruction. These findings occur when the passage of gas and fluid through the bowel is impaired, causing a buildup above the obstruction. Free air under the diaphragm is typically a sign of perforation, not obstruction, and requires urgent attention. Enlargement of the liver. Thickened bowel walls are suggestive of different pathologies, such as liver disease or inflammatory bowel conditions, but are not indicative of obstruction. Question 21. A 55-year-old male patient presents with a suspected brain tumor and is scheduled for an MRI of the brain. Which of the following is the most important consideration for ensuring a safe MRI examination? A. Ensure the patient is not wearing any metallic objects. B. Confirm the patient's renal function prior to the procedure. C. Administer a contrast agent to enhance image clarity. D. Restrict the patient's diet prior to the MRI to avoid contrast side effects. Answer. Correct answer A. Ensure the patient is not wearing any metallic objects. Explanation. The most important safety consideration for an MRI is ensuring that the patient is not wearing any metallic objects. MRI uses powerful magnetic fields that can attract metal, posing a safety risk. It is also essential to assess renal function if contrast agents are being considered, but this is a secondary concern when the primary issue is the presence of metal. The use of contrast is not always required, and restricting the diet is not typically necessary for an MRI, unlike other imaging modalities such as EE. Question 22. A 70-year-old woman with a history of chronic kidney disease undergoes a contrast-enhanced CT scan. Which of the following measures should be taken to minimize the risk of contrast-induced nephropathy? Sin. A. Use the highest possible dose of contrast to ensure optimal imaging. B. Ensure the patient is well hydrated before the procedure. C. Avoid the use of any analgesics prior to the scan. D. Limit the duration of the CT scan to reduce nephrotoxic risk. Answer. Correct answer. B. Ensure the patient is well hydrated before the procedure. Explanation. To minimize the risk of contrast-induced nephropathy, sin, in patients with chronic kidney disease, it is crucial to ensure the patient is well hydrated before the procedure. Hydration helps to flush the contrast agent out of the kidneys and reduce nephrotoxic effects. Using the highest dose of contrast or limiting the duration of the scan are not effective in sin. While avoiding analgesics may be beneficial in some cases, hydration remains the primary preventive strategy for sin. Question 23. A 60-year-old male with a history of lung cancer presents for follow-up imaging. Which imaging modality is most appropriate for detecting possible brain metastases in this patient? A. CT scan of the brain without contrast. B. Chest X-ray. C. MRI of the brain with contrast. D. Bone scan. Answer. Correct answer. C. MRI of the brain with contrast. Explanation. For a patient with a history of lung cancer, MRI of the brain with contrast is the most appropriate imaging modality to detect brain metastases. MRI is more sensitive than CT for detecting metastatic brain lesions, particularly when contrast is used. A chest X-ray is used to evaluate lung conditions but is not useful for detecting brain metastases. Bone scans are effective for evaluating bone metastases but not for brain lesions. Question 24. During a C-IDed biopsy, which of the following is the most critical step for ensuring the safety of the patient during the procedure? A. Ensuring the patient is fasting for 12 hours before the procedure. B. Verifying the biopsy needle's trajectory using fluoroscopy before insertion. C. Administering contrast to identify the lesion more clearly. D. Providing pain medication before and during the procedure. Answer. Correct answer. B. Verifying the biopsy needle's trajectory using fluoroscopy before insertion. Explanation. The most critical step in ensuring safety during a C-IDed biopsy is verifying the biopsy needle's trajectory using imaging modalities such as fluoroscopy to ensure precise needle placement. This minimizes the risk of puncturing surrounding tissues or organs. Fasting may be necessary for certain procedures, but it is not a primary safety consideration in a C-IDed biopsy. Administering contrast is not always required unless specifically needed for better visualization, and while pain management is important, it is secondary to ensuring proper needle placement. Question 25. In a pediatric patient undergoing ACAN, what is the most important consideration for minimizing radiation exposure while maintaining diagnostic image quality? A. Use a higher contrast medium to improve image clarity. B. Adjust the CT scan parameters to suit the patient's size. C. Conduct the CT scan with a full contrast dose. D. Use a longer scan duration to reduce radiation dose. Answer. Correct answer. B. Adjust the CT scan parameters to suit the patient's size. Explanation. To minimize radiation exposure while maintaining diagnostic image quality in pediatric patients, it is crucial to adjust the CT scan parameters to the child's size. This includes lowering the radiation dose and adjusting the scanning parameters based on the patient's body size. Using higher contrast, medium, or longer scan duration does not radiation exposure and may increase it. Pediatric patients are particularly sensitive to radiation, so optimizing the scan parameters for their size is key. Question 26. A patient undergoing a routine mammogram presents with dense breast tissue. Which of the following imaging modalities is the most effective for improving detection of potential malignancies in this patient? A. MRI of the breast. B. Mammography with a higher dose of radiation. C. Ultrasound of the breast. D. CT scan of the breast. Answer. Correct answer. A. MRI of the breast. Explanation. In patients with dense breast tissue, MRI of the breast is more effective at detecting malignancies than traditional mammography. Dense tissue can obscure tumors in a mammogram, making MRI an excellent adjunct for improved sensitivity. While ultrasound can also be helpful for additional evaluation, MRI provides more comprehensive and detailed images for detecting early-stage tumors in breast tissue. Mammography and CT are less effective in this context. Question 27. For a patient undergoing radiation therapy for a pelvic malignancy, which of the following is the most important factor to consider when planning the treatment to minimize radiation exposure to surrounding tissues? A. Using a higher radiation dose for better tumor control. B. Selecting a treatment technique that focuses the radiation beam on the tumor. C. Administering chemotherapy concurrently to enhance radiation effects. D. Expanding the radiation field to include a wider area of the pelvis. Answer. Correct answer. B. Selecting a treatment technique that focuses the radiation beam on the tumor. Explanation. The most important factor when planning radiation therapy for a pelvic malignancy is to select a treatment technique that focuses the radiation beam on the tumor while sparing surrounding tissues. Techniques such as intensity-modulated radiation therapy (IMAP) can precisely target the tumor and minimize exposure to healthy tissues. While chemotherapy may improve outcomes, it does not specifically address radiation exposure. Expanding the radiation field unnecessarily increases the risk of irradiating healthy tissues, which should be avoided. Question 20. A 40-year-old female presents for a diagnostic chest CT due to suspected pulmonary embolism. P. Which of the following imaging techniques is considered the gold standard for diagnosing P? A. Chest X-ray. B. Contrast-enhanced CT pulmonary angiography E/PA. C. MRI of the chest. D. Ultrasound of the legs. Answer. Correct answer. B. Contrast-enhanced CT pulmonary angiography E/PA. Explanation. Contrast-enhanced ET pulmonary angiography (EPA) is the gold standard for diagnosing pulmonary embolism (P). It provides detailed images of the pulmonary arteries, allowing for the identification of clots. Chest X-ray is often normal in P and does not provide direct information about embolism. MRI of the chest can be used in cases, but is less commonly used than EPA. Ultrasound of the legs is used for detecting deep vein thrombus (DVT), which can be a source of P, but it does not directly diagnose P itself. Question 29. In the management of a patient with suspected spinal cord compression due to a metastatic lesion, which of the following imaging techniques is most likely to provide the quickest and most reliable diagnosis? A. MRI of the spine. B. CT scan of the spine. C. X-ray of the spine. D. Bone scan. Answer. Correct answer A. MRI of the spine. Explanation. MRI of the spine is the most reliable and sensitive imaging technique for diagnosing spinal cord compression, especially in the context of metastatic lesions. MRI provides excellent soft tissue contrast, allowing for clear visualization of the spinal cord, nerve roots, and surrounding tissues. While CT can be useful for bone evaluation, it is less effective than MRI in identifying soft tissue involvement, such as cord compression. X-ray and bone scans are generally less sensitive for assessing spinal cord compression in this context. Question 30. A 6 to 8-year-old male with a history of prostate cancer presents for follow-up imaging to evaluate for bone metastases. Which imaging modality would be most appropriate for detecting bone involvement? A. MRI of the pelvis. B. X-ray of the pelvis. C. Bone scan scintigraphy. D. CT scan of the abdomen. Answer. Correct answer. C. Bone scan scintigraphy. Explanation. Bone scan scintigraphy is the most appropriate imaging modality for detecting bone metastases in patients with prostate cancer. It is highly sensitive for identifying areas of increased bone activity, which is common in metastatic bone disease. MRI and ET are helpful for localizing lesions, but are not as effective for whole-body bone evaluation. X-ray is less sensitive and may miss early-stage bone metastases, making it less appropriate for this purpose.